Hi, this is Dr. Doreste with the Cranial Release Technique. Back with another video, something a little bit different today. I personally just received a cranial release technique from my wife, so not 5 minutes ago. And I was thinking about what I wanted to speak to you about today, so let's just talk about me and my experiences over these last 25 years of me receiving cranial release technique. Me personally, me as the patient. So why do I do it? Thank God I don't have any health problems. My body feels good. I have plenty of energy. I sleep good. I eat good. My digestion is good. My energy is good. My physical coordination is good. I very rarely get a cold or a flu or anything along that line, which is just the body's response to healing. So I don't look at it as a bad thing anyway. So why then do I get on the table on a regular basis? And when my wife and I are together and when we have the time, it's, if not multiple times a week, almost daily, we'll do it to each other. And again, it brings us back to the concept that Dr. Sutherland came up with. Again, bringing us back to why are there 22 bones that make up the head? And of course, the easy answer is, well, the bones are there to protect the brain. That's the central nervous system. That's the computer running the show in your body. Okay, but why do those bones remain separate, as you can see here in the plastic model by the different colors? So why should they remain separate? And again, it was Dr. Sutherland that discovered more than 100 years ago. He was the one that theorized those bones stay separate because they need to move. And it was probably 25 years ago when I saw someone on a street corner as I was trying to figure a way how to describe what cranial release was to my patients. And I saw him there playing with this little device, and I said, oh my goodness, that's exactly what I'm looking for. And then I found out that this is called a Hoberman sphere, and you can buy them at a toy store, you can get them on Amazon, a Hoberman sphere. It's the greatest little toy to describe cranial release technique because, again, in all of us, we have this normal movement that's happening, this primary respiratory mechanism that Dr. Sutherland discussed. He said primary because it comes first, respiratory because there's an inhalation and an exhalation phase, and mechanism because all the parts take place in this movement. And as the cranium moves and as it breathes, it then transmits movement down into the body so that all the bones are moving, all the organs are moving, everything, the fascia, everything in the body is moving secondarily to the primary respiratory mechanism. And then the follow-up question is, well, so what's the big deal about that? Well, the big deal is in the world of, in any type of cranial work, the purpose is to open and align these cranial bones to enhance the primary respiratory mechanism. And that's exactly what we're doing with the cranial release technique. And that's exactly the same. Here's another concept that a lot of practitioners and sometimes patients don't really seem to understand. The patient that comes in with a migraine headache, or the patient that comes in with a musculoskeletal problem, or the patient that comes in with a digestive issue, or the patient that comes in with a urinary tract issue, or the patient that comes in with an ankle issue, a knee issue, a shoulder issue, a respiratory issue, a cardiac issue, whatever it is, a hormonal issue, you fill in the blank with whatever it is. The cranial release technique is exactly the same, regardless of what the patient complains of. Now that might not make sense to you, but again, what is the purpose of the cranial release technique? It's to enhance the primary respiratory mechanism. The theory is the dampening, the reducing of this primary respiratory mechanism now sets the table for anything to go haywire down the line, regardless of what name you want to put on it. Musculoskeletal, hormonal, endocrine, skin issue, thyroid issue, adrenal issue, whatever, kidney, it doesn't matter. The purpose of the cranial release technique is to restore and enhance the primary respiratory mechanism. So again, it doesn't really matter to me what the patient comes in with. It doesn't matter to me the age of the patient. It's exactly the same technique, whether it's a 1-day-old baby or a 97-year-old man. It doesn't matter to me. The technique is the same. The patient's primary respiratory mechanism is functioning. The problem is, in the world of cranial release, the problem is that has gotten weakened over the years from stress, whether it be from the birth process, from the physical, chemical, emotional stresses that we're all under every day. And what we're going to do with the cranial release technique is, by using the patient's own intracranial forces, we're going to help to open, align, and restore the primary respiratory mechanism, regardless of the condition or no condition. So for myself, I go and I receive the work on a regular basis to enhance function. That's what it's all about. I want my immune system to work at 100%, or at maximum for me, at maximum. I want my cardiovascular system to work at maximum for me, which might be a little different than you. We're all a little different. I want my digestive system to be maximized. I want my urinary tract system to be maximized. I want my musculoskeletal system to be maximized. It's a totally holistic wellness concept that most of us have lost track of, because most of us go along our merry way, do whatever we want, and then when the machine or the system breaks down, we run to someone to get it fixed, whatever it happens to be, and then we go merrily on our way until it happens again. And that's not the world of cranial release. The world of cranial release is that you were designed to be happy and whole and full of life and full of happiness and full of health. And secondary to all that is this primary respiratory mechanism, which is first. And if this primary respiratory mechanism is reduced, then everything else is going to suffer because of it. That's it. That's why we should have practitioners all over the world. We should have thousands upon thousands upon thousands of practitioners everywhere, so that anyone at any time could say, I think I should get a regular cranial release technique on a regular basis, not because I have a health problem, but because I want to maximize function. It's a completely different concept. The wellness holistic concept, the real health concept, versus what's going on today with the sickness model of run yourself into the ground, then take something for it, or get it removed, or something along that line, and then go merrily on your way until you have to do that again. That is 180 degrees different from the concept of the cranial release technique. Maximizing function by maximizing structure. How do you maximize structure? It's called the cranial release technique. It's a 1-minute technique that opens, aligns, and assists the primary respiratory mechanism that's present in all of us. If you're alive, those cranial bones are moving. They're doing the best they can. But when you look at a patient, you see the eyes are not balanced. You see the ears are not balanced. You see the skull is rotated, distorted. You see the shoulders are out of balance. You see the pelvis is out of balance. You see a short leg. All these distortions are all secondary to the cranium. That's the point I keep trying to explain to my patients and to my practitioners, so that we all get on the same page here and sing from the same sheet, so to speak. So, I think we went over a bit. It's all coming up on 10 minutes here. Dr. Doreste, Cranial Release Technique, saying happy holidays, happy holidays, health to you and your family. The primary respiratory mechanism, probably the greatest discovery in healthcare that no one knows about 100 years ago from Dr. William Sutherland. Okay? All the details. How do you find a practitioner? How do you learn more about the work? And how do you actually learn to perform the work? Is all on the website at cranialrelease.com. Again, that's cranialrelease.com. Thanks so much, everybody. Have a fabulous day. Merry Christmas. Happy holiday to everybody. Talk to you soon. Adios. Ciao for now, my friends. Bye-bye.